you did, what was good and what wasn't. Okay, so we'll start with what we did on what we did on the midterm, which was, these here. Gonna bring out a fan or something, you know, one of these little handheld
I
ones?
need one. It's just far from my glass, so I can't see it. But it,
Yeah. Okay. Are you ready?
see,
Okay. So we were talking about movement of patients from bed to stretcher, stretcher to bed, chair to bed. So basically, how many people does it take to move a stretcher patient from a gurney to the bed? 4 or more. Or in practical terms, as many as you can get. But certainly 4. Where, this is one which caused us a problem when we were talking about it, or when we did it for midterm. If you're moving somebody from a wheelchair to the bed, and he or she is paralyzed down the one side, at least let me finish. Okay, where would you stand?
You support their weaker side.
Say it again.
You support their weaker side.
The weaker side. Okay.
You can say it again. Do we need to sit here?
Okay. Huh?
Whatever.
So what is a slide board? Describe to me what a sliding board is.
Small,
Small?
has handles.
it's anti-static.
It has handles, yeah. Small?
Yeah.
Long. Should be at least, they usually are 6 feet long.
Oh, Lord.
Yeah. Anybody ever seen a backboard? Have you ever seen a backboard?
Yeah.
That's about the size of a sliding board, only it's much thinner. And it's usually made out of nylon or plastic. Definitely not made out of wood.
Aren't there handles on it?
There are handles on it, yeah, there's not on the backboard that there is on the sliding board. And how do you use it?
Slide it.
How? You have a patient, you have a bed, you have a sliding board. What do you do?
Sit the patient up.
Pardon?
I don't know.
No, go ahead.
Sit the patient up,
Sit the patient up.
maybe.
Don't you put it like under their back and then across like
Oh,
the
you
bed
roll them
and
onto
then like
it. No,
move?
you roll.
You roll them. Now, you have to be careful here, right? Because you don't want to roll somebody who has a bad back problem, okay? So you roll them. How do you roll them?
You roll them over, then you put like on their left side, say. Then
Mm-hmm.
you put the board where their back would be, and then you lay them back down onto the board,
Okay.
and then scooch.
Over halfway.
And then, yeah, okay. So, okay. So how do you roll them?
You support their head and neck. And
What is the technique that is used to roll somebody like that? Anybody know? It's called a log roll.
Yeah.
And how, describe a log roll? You move them as one. So the other thing is you should use a sheet. You have a sheet underneath them, always. You pull the sheet over. So you're rolling them, for example, towards me. You get a hold of the sheet, you roll them, you have somebody at the head, somebody at the feet, somebody in the middle, okay? So you get the sheet and you roll them and everything comes as one. So you end up on their side, you put the slide board underneath them as far as it can go, and then you roll them back onto the slide board. And then, if you're moving them, all you do is you hold the slide board and pull the sheet. You don't want the slide board underneath them when they get to the other side. So you're using the slide board to make a junction between the bed and the treatment bed. Does that make sense?
Bridge the gap.
Bridge the gap, yeah. So you don't want the slide board to come with you. It's possible that it will, but you don't want it to, because you have to take the slide board out. Can we treat through the slide board?
No.
No. Good. Okay. So we have some side effects here. But I've also got side effects in my other one here. Okay, okay. So, most common side effect from treatment, cancer treatment?
Fatigue.
Fatigue, yeah. What is mucositis? What is mucositis?
Inflammation of your mucosa.
Okay. Where is the mucosa?
Are you referring to like infection in the lungs?
Mucosa?
No, mucitis.
Mucositis.
Mucositis, can you get that in the lungs?
No, because there's no mucosa in the lungs. Mucositis is
Phlegm come from that.
from the throat. There's no mucosa in the lungs. There's mucosa in the esophagus and the trachea. There's no mucosa in the lungs. It's a lining of the head and neck. Right?
Yes.
Okay. So,
it's inflammation of the lining of the neck.
yeah, it's inflammation of the lining of basically of the head and neck. So let's go on to some emergency stuff here. What type of shock would you see in CT?
Anaphylactic.
Anaphylaxis. Why?
Allergic to the contrast, the contrast.
So we all know about a cerebrovascular accident, right? What's a cerebrovascular accident?
A stroke.
A stroke. What are the symptoms of a stroke? What do you look for?
Drooping of the
This
face.
on one side.
Drooping of the face, one side, right?
Mm-hmm.
What else?
Slurred speech.
Slurred speech. Anything else? Sometimes loss of consciousness, no. Not, it is common, but it's not, you don't always see it. What's epistaxis?
Nosebleed.
Nosebleed, okay. What's syncope?
Fainting.
Fainting.
Fainting. Okay. What would you do if a patient got had an episode of syncope? What would you do? What would be your first aid?
Check for breathing.
Pardon?
Check for breathing.
Check for breathing. Okay.
Check regular vitals and elevate their feet.
Pardon? See again. I didn't
That's
catch it.
Check them for vitals and elevating their feet.
Why are you elevating their feet?
To help blood flow.
Okay. So patient says that he just sat up after his treatment and he says the room is spinning.
Postural hypertension.
Postural hypertension. What type of tumor is most likely to cause spinal cord compression?
Metastatic bone.
Metastatic bone. Why? What does it do? What does the metastatic bone tumor do?
Can grow and compress it.
Compress what?
Spinal cord.
Spinal cord. Okay. You have to be specific. What do we use dexamethasone for? Anti-inflammatory.
Reduce swelling.
Thank you. Because there are other symptoms that, yeah, okay. What's its normal name? What's the other name for dexamethasone?
Decadron.
Decadron, yeah. I think I mentioned this last week. What is the anti-seizure medication that we normally use? Or was it a couple of weeks ago? Do you remember? It's not, it won't be on the test, but I'm just asking. It's called Dilantin. You might want to write that down because it's common.
How do you spell
Dilantin. In the US, what is the normal dose that is given for spinal cord compression?
3010.
Pardon?
3010.
2010, yes. In other places, it might be 2005. Okay. Main cause of superior vena cava obstruction. Hmm? Yeah, that's lung cancer, usually. What are the symptoms of SVCO?
Swelling.
Swelling where? Swelling where? I'm sorry, I can't hear you.
I don't know.
Oh, extremity. No, it's actually face and neck. So swelling of the face, swelling of the face and neck, distended veins, you can see them around basically upper chest and neck and face, and obviously shortness of breath. Those are the three. Okay. How often should fire extinguishers be checked?
Annually.
Okay. How far away should you be from a fire extinguisher?
75 feet.
Yeah, all together now, yeah. Why do they want the fire doors kept closed?
Isolate the fire, smoke, and
Isolate the fire,
So that you can escape.
yeah. And give yourself time to smoke. Give yourself time to avoid the smoke, put it that way, yeah. Okay. Where do you find the evacuation maps? Or where should you find an evacuation map? Pardon?
By fire extinguishers,
By the fire extinguisher or the fire poles?
stairwell.
They should both be the same place. There should be a fire extinguisher beside the fire pole or the fire pole beside the fire extinguisher. And the map should be in close proximity, shall we say. Okay. It's code for fire.
Red.
Missing infant.
Pink.
Long red. Why black?
Boom.
Boom.
Yeah, I remember getting told that at one point. I said, well, why do you use black? He said, because if a bomb goes off, everything goes black. Yeah, okay. Hazardous spill.
Orange.
Active shooter.
Silver.
Silver, yeah, silver. I think everybody knows that by now. Okay, so, let's see. Here's the new stuff, well, the old new stuff. What's thrombocytopenia? Low blood platelets, yeah. I'll give you choices here. The effective response that occurs most commonly among cancer patients is anxiety and depression, anxiety and coping strategies, or depression and coping.
Anxiety and depression.
So that's the first one, right? Okay. Marasmus. Anybody heard of marasmus? What is it?
Malnutrition.
Malnutrition?
Is marasmus total calories, or is that the one that, I remember one specifically protein and one's total calories. I don't remember which one.
Marasmus is protein.
Protein.
Marasmus is protein, not malnutrition. Okay. Definition of chronic pain. Pardon?
lasting more than 3 months.
Yep. Okay, I'm gonna give you 4 items. You have to tell me which is the odd one out. Non-specific side effects include all of the following except fatigue, pain, weight loss, sleep.
Pain.
Pain.
Oh, yeah.
Pain, because it is specific, it's not non-specific. What is defined as identifying with feelings, thoughts, or experiences of another person?
Empathy.
Empathy is correct. I'll give you 4 more items here. Skin reactions include all except which of the following? Erythema, Alopecia, dry desquamation, the moist desquamation.
Alopecia.
Alopecia. Why?
Hair loss.
Pardon?
Hair loss.
Hair loss, okay. Somebody at one point said, well, alopecia is a skin reaction because the hair comes out of the skin. Okay. Anyway, that is correct.
I guess it's the least correct then.
Yeah. Assessment of the patient allows healthcare workers to do all of which of the following except determine the nature of the problem, select an invention for that problem or intervention for that problem, evaluate the I'll start again. Assessment of the patient allows healthcare providers to do all of which of the following except determine the nature of the problem, select an intervention for that problem, evaluate the effectiveness of the intervention, and find a cure for the disease. Which is
Find a cure.
Find it here.
stupid question. Okay. Anemia is what?
Low blood count. Low iron.
Low iron,
That's what I said.
which is part of which blood system? Red blood cells. Right? Okay. So again, some for special attention is needed in caring for which of the following? Elderly, children, adolescents, or all of the above?
All the above.
Yes, okay. Which of the following terms describes the complete destruction or elimination of all living microorganisms? Can somebody tell me without me reading them out? Okay, I'll read them out. Medical asepsis, sterilization, vaccine, or asepsis?
Vaccine.
Pardon? I didn't get that one. Did you answer it?
Sterilization.
Sterilization?
I said vaccine, but I was joking.
What's the most important way to prevent spread of infection? Come on, it's been hounded at us for the last year. Washing your hands, yes. Washing your hands. What does the CDC stand for?
Center of Disease and
Say again?
Centers for Disease Control.
Centers for Disease Control, no. The correct name is Centers for Disease Control and Prevention. I know it just says CDC, but the official name for that agency is Centers for Disease Control and Prevention. Which of the following describes sources of nosocomial infection?
Hospital.
Pardon?
Hospital.
Carpet in a radiation oncology department, fresh or dried flowers, pen used to apply marks used on all patients, both B and C, or all of the above?
all the above.
All of the above, yeah, they're all, yeah. All of the following statements describe the use of standard precautions, except which? Wear gloves when touching blood and body fluids. No hand washing is necessary if using gloves. Mouthpieces are used when performing CPR, and never recap used needles.
No hand washing.
No hand washing, yeah. Recommended vaccines for healthcare workers. Can somebody tell me?
All of them.
All of the above. I don't care what's there, it's just all of them, yeah. Exactly, yeah.